Hi, I'm a clinical exercise physiologist and I help people treat and prevent heart disease. And today I'm talking about risk factors. And the risk factor I'm talking about is hypertension or high blood pressure. Now, high blood pressure is one of the ones that are a little bit more on the risky side, and it's partly because it's a kind of a silent risk in the sense that we don't necessarily know when we have high blood pressure. It's something we need to talk to our doctor about. We need to make sure we're checking our blood pressure regularly just to make sure that that blood pressure is staying okay, specifically if you have family history of having high blood pressure. Now, the reason that blood pressure or high blood pressure is a risk for your heart is a couple of things. So, one, we have these arteries in our body, all over our body, but specifically there's arteries that sit on top of your heart called your coronary arteries. And the inside lining of those arteries is really soft, delicate, baby smooth skin. And so when cholesterol comes flying down those arteries, it can just slip on past that very delicate baby smooth skin, no problem at all. But when we have high blood pressure, every time our heart beats, it's pushing blood against that artery in a very high pressure way. So it's causing friction every time your heart beats against the inside lining of that artery. And so that lining turns from being really soft and baby smooth to rough and pitted and gravelly. And so now when cholesterol comes flying down that artery, instead of slipping on past like it normally would, it gets caught in those little micro cuts and micro tears that are formed and gets sucked in behind that first layer of skin, which forms almost what you can visualize like a blister. And now over time, that blister can get bigger and bigger, starts to narrow down that artery. So it's less likely or less able that the blood is able to get past that little narrowing, and it causes risk for it to actually break, which forms a heart attack in its own. So we can talk a little bit more about blood pressure and obviously all the different ways that we can help to control it, but it is something that we want to keep an eye on, as well as the fact that every time our heart beats, if it has to push and use that muscle so much so to push that blood forward into this high pressure system, it can start to remodel the heart itself. So we'll get into all the different things that we can do to help with high blood pressure, but just make sure, first of all, that you're checking it, specifically if you have heart issues or family history, and keep those numbers in check. All right, talk to you soon.